Dr. Luke Berguson here, physical therapist at McLean Racket and Health Club and owner of Resolution Physical Therapy and Performance. Today I want to talk about something I get asked about all the time, and that's the rotator cuff. So the rotator cuff is actually a series of 4 muscles that work together to rotate the shoulder during movement. More specifically, if you think about the ball and socket of the shoulder, the rotator cuff keeps that ball centered within the socket to prevent it from getting jammed up every time you raise your shoulder. Issues with the rotator cuff tend to present as a non-specific pain, meaning it can be widespread throughout the shoulder, but it usually sits on the outside part of the shoulder in this region. Activities like reaching above your head or behind your back, like you're trying to reach into the back seat of the car, or even sleeping at night, tend to be painful activities. We really break up rotator cuff tears into 2 different categories, and that's traumatic or degenerative. For those traumatic tears, you can really think of someone slipping on ice and falling on an outstretched arm, feeling a pop, having immediate pain. Those ones often need surgery to resolve. The other type, the degenerative tears, you can just think of the normal wears and tears of life, just using your shoulder a lot over the years. Those actually, depending on the size of the tear, tend to respond well to conservative care, like physical therapy. It often surprises people that they're fairly common in people, especially over the age of 50, to have these small tears. Treatment of this first starts with getting an evaluation by someone trained to look at not just the shoulder, but the areas around the shoulder. Really finding out, why did this shoulder just start to bother you now, when there may have been one of those small tears that have been there for years and years. Areas like the mid-back, the shoulder blade, those all need to be looked at. And sometimes it's as simple as open up that mid-back, improve the posture, stretching out that shoulder. That can give that rotator cuff some more room to heal. Then you follow that up with specific exercises to strengthen not just the shoulder, but the shoulder blade, to give it a strong base to raise up on. If any of this sounds familiar to you, or you want to prevent rotator cuff issues in the future, or if you just have any other questions or want to learn more about the rotator cuff, feel free to reach out to me. My email is lukeberguson.dpt@gmail.com, and that's in the comments below as well. Hope this helps, and please reach out if you have anything else.